Have you had your vaccine yet? That's apparently the new greeting among friends, but as the COVID-19 vaccines become available to a wider age group, it puts a spotlight on an even younger group, children, who are now part of the vaccine studies. We look into the research being done on how COVID vaccines affect children and also what children and parents need to know as they go back to in-person classes.
And welcome to Fox 11 News In Depth. I'm Bob DeCastro, in for host Hal Eisner, who is still out on medical leave. We're going to bring you an update on Hal's recovery a little later. Right now, let's talk about those COVID-19 vaccines. It is estimated that about a third of Californians have gotten at least their first dose of a COVID-19 vaccine, and distribution is expanding as supplies increase. And now parents are looking at whether there will be vaccines for their kids, and researchers are testing vaccines on younger and younger kids. Here to talk to us about COVID and children is Dr. David Michalik, the director of Pediatric Infectious Disease at Dignity Health, St. Mary Medical Center in Long Beach. Doctor, welcome. Thanks for joining us to talk about this very important topic. I want to know what you're telling your patients, the parents who have these children. The vaccinations are now expanding across the state to those 16 and older, and soon we'll see potentially vaccines available for those even 2 and up. What are you telling them?
Bob, as you know, the COVID-19 pandemic has affected so many lives, and the efforts to try to suppress the pandemic require multiple modalities, not just the distancing and mask wearing and hand hygiene, but also significant efforts towards vaccination. The rate at which we have escalated our response to the pandemic has been incredibly fast. You can imagine how fast the vaccination trials have gone through, and we've seen a lot of good work come from many manufacturers with the vaccine in adults. So it only goes to show that we need to address what to do with the younger contingent in our population. Children make up about 25% of the population here in the United States. So if you really want to be serious about getting this pandemic to cease, and we really need to address how to protect our youngest patients.
So it almost seems like saying you're doing this in large part for the greater good, so that we can protect the bigger segments of our society. But what would you say to parents out there who are trying to weigh the risks, whether or not this is risky for their kids, when they've been told all along, especially for younger kids, that they are generally asymptomatic when it comes to COVID-19 and they don't really exhibit any symptoms? Why should they be getting the shot?
Well, that is what the data does tell us, that the majority of individuals who have severe disease from COVID-19 are those that are 55 and older. And for children, the likelihood that they're going to have a bad outcome from COVID-19 infection is incredibly low. So one can naturally assume that the parental response against vaccination is called into question. Yet I will say that there still is infection that does occur in children. Now, granted, those numbers are estimated to be about 1 in 10,000 potentially could actually die from COVID-19 infection. Last year, we had death rates in the United States in children of approximately the same amount that we have from flu, the influenza. So I still think that we should not ignore those numbers. I still think children should be protected from getting COVID-19 infection, specifically for the bad outcomes that they potentially could get. But also, we as in the medical field don't really understand what asymptomatic infection does to children in the long run. Are there going to be some as of yet undiscovered effects that we might discover months or years later? So I think we really need to make sure that we think about that as well. The last thing I think is really important to mention as well is, while children largely are asymptomatic when they have COVID-19, it is this passing between children where these variants might occur. We've been hearing a lot about variants in the news these days, and it takes different strains from 2 different individuals to commingle to potentially produce a new variant that the current vaccine schedule is less effective against protecting adults and anyone for that matter So I think we also need to think about that as well.
Sounds like there's still a lot to be learned out there, and there are clinical trials now underway in terms of giving children, especially young children, this vaccine. What do you know about that, and how quickly soon could they roll this out, do you think, for very young children?
Well, right now we have a vaccine that's available for anyone 16 and older. That is the Pfizer mRNA vaccine. Currently, we have the emergency use authorization for that age group. Most recently, Pfizer submitted to the FDA another expansion of their emergency use authorization to allow to include the age groups of 12 to 15. They most recently have some preliminary data looking at approximately 2,300 children, half of which were given the vaccine and half of which were not given the vaccine. And they actually found really surprisingly great numbers of immune responses in those kids that were vaccinated, that were 12 and older. Because those numbers are very encouraging, and because the safety profile of those children that got the vaccine was not any different than what you would expect to see in adults, they made that submission to the FDA. If the FDA deems that it is worthy of an expansion of the EUA, then I suspect that we probably will see the vaccine roll out in children as early as late summer. Now, as you mentioned, they're also looking at vaccinating children younger than 12 years of age, and some preliminary studies are being done in those age groups as well, not just with Pfizer, but also with Moderna, and also with the Johnson & Johnson vaccine.
And really quickly, Doctor, we only have about 30 seconds here, but what are you saying to parents now sending their kids to school? The final word here, you seem to be on board with vaccines. They don't have the vaccines as of yet, but yet they're sending their kids to school.
Well, I think we all encourage as healthcare providers to send kids back to school. We all want to go back to some level of normalcy. Our kids are lagging behind academically, and they also want to commingle with their peers, and also the mental health impact on children is great. So the American Academy of Pediatrics has now for several months recommended that kids return. I think adding vaccination as an added level of protection might encourage some parents to be more likely to send their kids back to school because now they've been vaccinated.
Dr. Michalik, we'll talk to you in just a bit. Coming up next on Fox 11 News In Depth, we have more with Dr. Michalik about the problems of COVID, the vaccines, and where we go from here. We'll have all that right after the break. And we're back now with Dr. Michalik to talk more about some of the current COVID concerns. One of the recent ones is that pause in the use of the Johnson & Johnson vaccine just days ago. That halt coming after several women wound up with rare, dangerous blood clots. Doctor, we want to ask you about that. These blood clots, and we should say extremely rare situations. What's happening here with these women?
Well, it appears as though some individuals who've been vaccinated with the Johnson & Johnson vaccine, approximately 6 to 13 days after vaccination, began experiencing symptoms consistent with clots. Now, these clots can occur in multiple areas, specifically in the lungs, causing a deep venous thrombosis, potentially even in the brain. There has been one woman out of the 6 that were identified through the Vaccine Adverse Event Reporting System, or VAERS system, one woman that unfortunately passed away and one is in critical condition. So this ended up being about one person per 1 million doses given out of the 70 million individuals who've gotten Johnson & Johnson in the United States right now. So the FDA has decided to put a pause on things. And as we are speaking right now, the Advisory Committee on Immunization Practices is actually reviewing that data to make a determination on what comes next.
So why women in particular do you think have been impacted in these very rare situations?
That really hasn't quite been understood yet. I think that is definitely a consideration. It is unique that it would just occur in women, but the answer to that is right now not known.
All right, and let's talk about anyone who's already had the Johnson & Johnson vaccine prior to this pause. What concerns should they have? What are you telling them?
Certainly valid to have those concerns, and we're already as medical professionals getting those calls and questions today. Certainly, we need to first find out what the ACIP is going to be concluding, and then also we need to, as medical providers, just be aware that we're going to be getting phone calls from patients who complain of symptoms consistent with clots. Those symptoms can be headache, chest pain, blurry vision, seizure, anything like that. If those are things that patients are experiencing, please have them contact their primary care provider or seek some kind of a medical evaluation to make a determination. Although, let's wait and see what the final analysis is from the FDA.
I've had some people ask me, doctor, if they should be taking aspirin or some kind of a thinner. What would you say to that for people concerned about having the Johnson & Johnson vaccine? And I don't know why it's out there, but just for some reason they've been told to take an aspirin.
I would advise against that for multiple reasons. Number one, aspirin in and of itself has side effects. Number two, we need to first understand the mechanism of what the clot is actually doing. The specific clots that are being described may not respond to mainstream therapy or blood thinners as we might know it, blood thinners like heparin. So unless you're taking aspirin already for a pre-existing condition, I would, at this point, talk to your primary care doctor about it and hold off on it unless there's another reason to do that.
So the pause doesn't seem to be too much of a concern in terms of the vaccine supply. Even here locally, they're saying in the state of California, the city of LA, it's a really small percentage of the inventory of the vaccines that they have. And now they're just pivoting and distributing the other vaccines to people who already had appointments for the Johnson & Johnson vaccine. What would you say to people now who are now going to get this other vaccine who may be concerned that there has already been a pause in vaccines, and maybe they're going to say, you know, let's just wait a little bit to get the final word about these vaccines? What about the efficacy and the safety of the other two vaccines?
Well, as healthcare providers, we tell our patients, get the vaccine that is immediately available to you. If Johnson & Johnson vaccine is going to be on pause for a longer period of time, and the only other two out there right now are the Pfizer and the Moderna, then you should by all means go ahead and get those unless there is a specific reason why you as an individual would not want those. There are, of course, side effects associated with any of the vaccines and any medical products for that matter. Those are things that you can discuss with a medical professional. And the clotting that we have been hearing about with the Johnson & Johnson is not something that we're inherently seeing with the mRNA vaccines at this time.
And really quickly, less than 30 seconds here, more and more of us are getting this vaccine. When do you expect to see some sort of herd immunity, so to speak, when we can at least free up our society a little bit more?
In order to achieve herd immunity, which I think is the goal for a lot of healthcare providers, we really need to get vaccination rates, or at least individuals who've been infected and then have some protection after that, of 70+% of the population. So we still have a lot of work to do to get to that number, and that includes trying to get children vaccinated as well. I remain optimistic, though, as do all healthcare professionals, that we will come through this. It's going to require a lot of positive messaging to reinforce the benefits of vaccination and for us to continue to emphasize the importance of mask wearing and social distancing.
Well, we appreciate your optimism and your information. Dr. Michalik, thank you so much for all of your time. We will talk to you soon. Thank you so much.
Thank you for having me.